This short video aims to prepare you for your medical emergencies assessment. The assessment will involve a scenario with an acutely unwell patient, which will be represented by the Laerdal simulation mannequin. This is the same mannequin and environment that has been used throughout your training. All assessments are recorded. This is to ensure that assessments are equitable and fair. The recordings will be stored for a year in accordance with university requirements. Thereafter, recordings will be permanently deleted. Successful completion of your medical emergencies assessment is required before you are able to progress to graduation. If you are unsuccessful in the first instance, subsequent attempts will be arranged. Detailed feedback will be provided on your assessment performance to allow you to prepare for subsequent attempts. You will receive notification of your individual assessment slot through timetabling. You will be allocated a 20-minute slot. Your assessment will last approximately 10 minutes. You will not receive any feedback on the day of your assessment. You will receive notification of your results within 6 weeks. On the day of your assessment, please take a seat on the corridor outside the medical emergency suite and wait to be invited in by the assessor. Non-uniform and uniform are both considered appropriate forms of dress for your assessment. You must bring your student ID card to the assessment. Assessors are required to see this prior to being able to start your assessment. Brilliant, I'll give you that back. Okay, so what's going to happen now is we're going to get you through to the assessment room. Leona's going to act as your assistant and she will stay in with you throughout your entire assessment. You can delegate tasks out to Leona and assume that she's competent to perform those tasks. Okay. But unless you actually delegate something to her, she's not going to do anything for you, okay? When you enter the room, first thing I want you to do is just to state your name clearly for the purpose of the recording. Then if you turn to Leona, Leona will give you a brief summary of the patient that she'd like you to see. From that point on, it's over to you, okay? I will stay on the outside, and once your assessment is complete, I will indicate that to you over the microphone. Then you're free to collect your things and leave. There'll be no feedback on today. Okay? In preparation for your assessment, the marking criteria is available on the medical emergencies area of the VLE. Ensure you are familiar with the marking criteria. In summary, during your assessment, you will be expected to demonstrate systematic use of the ABCDE approach to assessing and reassessing the simulated patient. You are required to correct any problems as you encounter them. At least one respiratory rate and heart rate with clear statements as to the definitive values measured must be undertaken by you. Thereafter, you can ask your assistant to monitor respiratory rate and/or heart rate if you determine that further measurements are indicated. Your communication, leadership and team working skills will also be assessed throughout. We hope that this video helps you to prepare for your medical emergencies assessment.